Hello, and thank you all for attending the Empowering Women in Rural Africa Tackling Occupational Safety and Health Risks for Social Justice webinar today. My name is Kelly Nichol, and I am President of the Institution of Occupational Safety and Health, IOSH, and we are honoured to be celebrating the World Day of Social Justice by hosting this webinar. In November 2007, the United Nations proclaimed the 20th of February as World Day of Social Justice, a day to remind us of the need to build fairer, more equitable societies. In 2023, the ILO decided to launch the Global Coalition for Social Justice as a vehicle for collective action. IOSH was delighted to be among the first organisations in 2024 to accept the ILO's invitation to join the coalition. This webinar will mark World Day of Social Justice. It will demonstrate how occupational safety and health intervention with relevant stakeholders can lead to the economic and social empowerment of vulnerable communities working in the informal economy. This webinar will highlight the positive outcomes achieved through collaborative working to support and empower hard-to-reach communities of women working in informal economies in Ghana and Kenya. These are shea butter producers and textile weavers of North Ghana, and the fishmonger women of Lake Victoria and quarry scavenger widows of East Kenya. These hard-working women were all experiencing chronic workplace harm at the start of the project, with negative domino effects leading, in some cases, to extreme societal challenges, such as malnutrition, child labour, early removal of girls from school, and sexual exploitation, to name a few. We will shine a light on the interventions done to date in collaboration with our country partners, local safety and health experts, ILO country offices in Ghana and Commonwealth Businesswomen Africa to improve the working conditions of women in said communities. The speakers, our key partners in Ghana and Kenya, will also share their experiences of this collaborative project and present the progress made and future plans of action for each community based on the risk assessment recommended interventions. Within this session, we'll also highlight the social values of good occupational safety and health and to inspire similar collaborations and provide an example of the simple yet effective ways to practically and visibly improve lives and advance social justice. On the screen, you can see the agenda for today's webinar, and we are honoured to have support from our partners and IOSH representatives here today. We will have a question and answer session towards the end of the webinar, so please feel free to add your questions into the Q&A section underneath. In this session, you'll hear from me, my colleagues from IOSH, Ruth Wilkinson, Head of Policy and Public Affairs, IOSH Vice President Dr. David Arku, and we're also delighted to be joined by Nanis Kana, IOSH consultant and IOSH professional, Helena Obiti, founder of Lana Empire Foundation, and Dr. Muso Nyandusu, Secretary and Director of Occupational Safety and Health Services in Kenya. These have all been instrumental within these projects to date and will continue to be vital partners. Our IOSH Chief Executive, Vanessa Harwood-Witcher, had hoped to join us today since she participated in the launch event for the Global Coalition for Social Justice last summer in Geneva. However, another commitment means that she is unable to take part, and she does send her best wishes. Before we move on to this session, a few housekeeping rules, if that's okay. Please ensure your microphone is muted, and if at all possible, cameras on throughout the session so we can see all of your lovely faces. We have scheduled time at the end of the session for question and answers, so please feel free to add your questions into the Q&A box, and these will be answered within the Q&A section towards the end of the webinar. So, many of you will know who IOSH are already, but for the benefit of anybody who is unfamiliar with us, the Institution of Occupational Safety and Health is the largest professional body for OSH in the world, and we were established 80 years ago. We now connect, develop, and support over 50,000 members across 130 different countries. We qualify new entrants into the profession, and ensure their skills remain sharp through a commitment to continuing professional development. We are a charity that exists for public good, protecting workers through good safety and health at work. And all of our commercial activities are not for profit, so we reinvest revenue from our public training courses and other business activities into developing and promoting the profession and OSH professionals. All of our work pursues our long-standing vision of a safe and healthy world of work for everyone, no matter what work they do, no matter where they are in the world. In June 2022, the International Labour Organization, the ILO, recognised a safe and healthy working environment as a fundamental principle and right at work. And we are committed to encouraging this and advocating ways to make it a reality. This informs our values, our principles, and what we stand for. We are delighted to join the Global Coalition for Social Justice because its purpose links so closely with our own guiding vision of a safe and healthy world of work. Social justice and sustainability are at the heart of IOSH's vision of a safe and healthy world of work. They're woven into our mission as a membership organisation, charity and NGO, and they're a fundamental part of our strategy, Activate 2028. However, for many years, corporate sustainability management and reporting was dominated by environmental concerns, reducing pollution and, as climate change ramps up, cutting carbon emissions. But that focused unsustainably on just one dimension. Social sustainability, the S in ESG, has been gaining more traction recently, and IOSH has advocated this for a number of years now. The need to care for people and to look after their needs while protecting the planet is vital. Keeping people safe and well at work promotes healthy lives, communities, and societies, sustainable business practices, productivity, and performance, and gives us all hope for the world. Major institutional investors and the fund managers who take care of their money are prioritising companies with strong sustainable credentials. Those fund managers' stewardship departments are asking companies for information on their diversity policies. Value chain managers and sustainability specialists in major corporations are demanding evidence of their suppliers' work to eliminate modern slavery. They're also increasingly asking suppliers about their accident and ill health rates, because protecting workers from harm is the foundation on which all other social sustainability work is built. Any effort to increase the inclusivity and diversity of your workforce or to benefit the community is just window dressing if you do not keep your workers safe from harm. We divide our work to promote sustainability into 4 domains or dimensions. Number 1, sustainable societies. This is the macro level, ensuring the fundamental rights of people to healthcare, education, and freedom from discrimination. Our work to influence governments, policymakers, and standard setters fits into this domain. Number 2, socially sustainable business. This reflects businesses' responsibility and capacity to influence its workforces and communities positively. Our contributions to this dimension is through our engagement with businesses, business leaders, investor groups, and so on, making the case for good health and safety practice. Number 3 is socially sustainable work. We exert influence on safe working conditions, fairness, workers' well-being, and all other conditions of decent work by helping equip and enable our members to do their best work, acting directly in the workplaces to foster great working conditions. And number 4, sustainable climate and work. As I said earlier, the environmental component of sustainability is the part that has received the most attention in the past. But there is an aspect of environmental management that crosses over to safety and health and social sustainability. That is the way that climate change impacts on work, whether in increasing temperatures, curbing work hours, something employers in this region of the world are already very familiar with, or the risks posed by more extreme weather events. Organisations' climate change resilience is going to be determined partly by how they protect their workers. Social justice runs through all of these dimensions of sustainability and is chiefly what motivates us through our vision and mission to do the work we do. We were delighted to join the Global Coalition for Social Justice because its purpose links so very closely to our own guiding vision of a safe and healthy world of work. It's right and just to assure the safety, health and well-being of all workers, whether in the formal or informal economy, and we champion a safe and healthy working environment as a fundamental principle and right at work. As a charity for the public benefit, an organisation in special consultation status with the United Nations Economic and Social Council since 2023, and an ILO accredited international non-government organisation on the ILO special list since 2006, we strongly support the UN system and multilateral partnerships among all stakeholders seeking to attain social justice and decent work so no one is left behind. We're committed to accelerating implementation of the 2030 Agenda for Sustainable Development and the Decent Work Agenda, and we recognise the urgent need for organisations like ours to collaborate. By joining together, collectively, we can intensify efforts that address social justice deficits and achieve positive changes. If true social justice is to become a reality, we believe that safe and healthy work must be mobilised as an agent of change, and that the protection of workers' safety and health must become a universal aspiration for social justice to drive that change. Now, I'd like to introduce Ruth Wilkinson, Head of Policy and Public Affairs here at IOSH. Ruth will provide a policy-level explanation of the importance of OSH in achieving social justice, especially for workers in the informal economy. She will propose how IOSH's social sustainability model and actions can drive positive change and promote safe work as a lever for social justice throughout communities worldwide. Ruth, over to you.
Lovely. Thank you ever so much, Kelly, and thanks for having me on this important session. As Kelly's mentioned, I'm going to be looking at the role of occupational safety and health in achieving social justice. So I will use the acronym OSH when referring to occupational safety and health. Next slide, please. I'm obviously going to talk about that policy level explanation of OSH, where it sits within this landscape, but then also narrow down a little bit into the work that IOSH has been doing. I won't say a lot though, will keep it top level because there's other speakers who have been involved a lot more than I have at this stage. So next slide, please. So first of all then, social justice. I always like to make sure that when we talk about anything, we're really clear and on that same page. So social justice, this is taken from the Declaration of Philadelphia, and it talks about social justice being for everybody, so all human beings, and where we have that right to pursue, it talks about material well-being and spiritual development in conditions of freedom and dignity, of economic security and equal opportunity. So this provides us with some key elements that need to be in place. But I'd like to explore these in the essence of decent work. So next slide, please. So the Director General at the 111th session of the International Labour Conference, of the ILC, presented a report on social justice, and part of that report narrowed in even more specifically on actually what does this mean through the lens of decent work. And the Director General in that report talks about, well, actually for social justice, there's got to be fairness, there's got to be equity, and actually it's about people having a voice and agency to shape their own life. And these are the words of the Director General and not my own. So I just want to make sure I have got that caveated. It talks about having access to opportunities for employment. So you can see in one of the little darker blue segments there, it talks about equal access to opportunities. Well, that includes to employment and also having adequate standards of living. Also having access to justice and the rule of law. So real key fundamentals in the societies, in the communities, in the world that we all live in. So when it talks about, if we just focus on those inner blue segments at the moment, if we talk about having access to those universal human rights and capabilities, well, yeah, we've all got that right to those. We need that equal access. It needs to be fair. And obviously there needs to be those just transitions that we talk about. But if we wrap around that, actually, what does that mean through decent work? And at decent work talks about having obviously fundamental principles and rights at work for which all of us who are at work are entitled to receive. And Kelly mentioned this in the opening session that actually the fifth one that was added back in 2022 was the right of a safe and healthy working environment. So that is sitting there for all of us and entitled to have that. And we want to make sure that that's recognised globally. There also should be that social dialogue and that tripartism, which is obviously what the ILO champions, which brings worker representatives, government representatives, and employer representatives all together to have that social dialogue. As people, as well as workers, it's important that we have the right social protections in place and labour protections, and we have full, productive, and freely chosen employment. So we can see that there are direct links between decent work and our development as human beings. So this is about having safe, healthy, well populations who are obviously contributing to their local communities, to the wider economy, and to that wider global economy, and that they're thriving at work. So there really is a connection here between that decent work agenda. So next slide, please. So narrowing it down a little bit more, then we've talked about decent work, and we also know, and it's recognised, that occupational safety and health is part of that decent work agenda. It's been referenced and it's been linked to. So what are those benefits of having decent work? Well, if we think about that definition that was at the start from the Declaration of Philadelphia, it talked about having material well-being. Well, actually, part of that is having that decent employment has got to be a priority for all. And if you haven't got decent employment, people haven't got safe, healthy working practices, then obviously they've got the opposite of that. They're working in poor conditions, they've got unsafe working practices, and we obviously see the negative impacts of that happening. So at the top of this slide, I just wanted to say, actually, although we know we've got a fundamental principle and right at work of a safe and healthy working environment, we still see millions of people who are undertaking unsafe and unhealthy work every day. And this is where the case studies that we're talking about here today in rural Africa, it just illustrates some of that work that's happening on the ground. We're not just talking about numbers, we're talking about real people undertaking day-to-day activities that are having an impact on their health and safety. And Kelly highlighted some of those impacts a moment ago. So when we talk about poor health and safety, there's a real human and economic burden of those poor working practices and conditions. And we also need to remember that actually there are some in our communities who are more vulnerable than others, who are in those working communities. We think of migrant workers, women, pregnant women as well. So we need to be considerate of all who are in that sphere. So on the flip side, then, if we can make sure that, and I've talked about having good occupational safety and health, so it's important to say that actually we need the right practices in place. And it's not just about giving people work, it's about giving people good work, decent work. So if we can get the good OSH, we can get the good and the decent work, then obviously we can move forward to help reduce human pain and suffering, which is the moral reasons of why we do good occupational safety and health. Naturally, we want to be preventing fatalities, reducing instances of occupational ill health and disease as well. And if we do all of this, then obviously we can also contribute to that income for those individuals, because they'll be able to work, they'll be able to stay in work, they'll be able to be more productive and engaged at work, which in turn, if those individuals are able to work, get a decent income, it can hopefully have an end contribution to reducing poverty and hunger, because people have got money, they're able to use that money, and it can contribute in the main to provision of sustainable work. So these are some national level contributions, but at a business level, it will also stop individuals from needing to go off work, so that lost time. It'll stop people having to stop work altogether. It can obviously help support that productivity and help drive down costs, whether they're direct costs of somebody being injured and being absent from work or those indirect costs. So there are lots of benefits to having good occupational safety and health. And if we can do all of this right, it can increase productivity, it can save those costs. And I suppose that a key bit on here where I've put it can impact the economy and the state is that when we talk about good occupational safety and health, we do look at it through a business lens and an individual lens, but we also need to look at it at that national level, that actually, if you have got workers who are economically inactive, they're unable to work and contribute to the labour market, then of course you've got people who might then be reliant on the state for benefits, direct care, direct support. If we can actually support people to be safe, healthy, and well, they'll be able to engage in that labour market and be able to engage in that economic outturn and that productivity as well. So good occupational safety and health can contribute to that national development through a thematic area and a lens in its own right, as well as through the social and the labour lenses. So next slide, please. So we've talked quite a little bit about the value of good occupational safety and health. And Kelly mentioned that we believe at IOSH that safety and health at work must be mobilised as an agent of change so that we can protect workers. And this must be that universal aspiration for all of us through social justice to help drive that change. So looking at the IOSH projects then, in this past year, our staff at IOSH and also our member volunteers, along with global partners, which includes the ILO, ISA, the Commonwealth Business Women Africa, Department of Occupational Health and Safety Services, and the Ministry of Labour Relations Ghana, we've obviously piloted 4 projects in rural Ghana and Kenya to improve the working and living conditions for women in marginalised, hard-to-reach communities with the ultimate aim of saving lives. And I've got it's a bit of a scatter of different points on here, really. But what this project does is it focuses in at that ground level, at that localised community work operation level, through the lens of occupational safety and health. It isn't about one particular partner undertaking this work either. It's about collaborations, multi-stakeholder engagement, as I just mentioned. So it really is about bringing all different actors together. When we talk about sustainable development, as Kelly mentioned, sort of that S in that ESG, there's lots of different actors that have got a role to play. So this project actually brings lots of different actors together in that localised setting. So how can we support these individuals undertaking these different roles? So it was based on good collaboration, but it also utilised the OSH expertise of IOSH members on the ground. So going through the different risk assessments, looking at the, supporting through that awareness and that training and that skills, and how can we provide what kind of good working practices and working conditions do need to be provided and level. So we talk about making sure that you've got that social dialogue with all key individuals. We talked about governments, worker representatives, making sure that there is the right awareness and that skills development is also key to this. As through any good occupational safety and health implementation, there's got that awareness of the hazards and the risks, what can cause harm, and how can the controls that are being put in place support those individuals. And this needs to be continuous as well. Also recognise that actually there's financial benefits to doing this, and investment opportunities were sought to help provide support in these local areas as well. And if I get into some of the generalities of this particular work, which I know colleagues on the call will talk about in more detail, but there's it provides, when you support individuals to work in the right, safe and healthy work environments in safe and healthy ways, it does also offer those opportunities to move from that informal sector into the more formal sector, because it'll open up some opportunities. And we saw that come through in one of the projects where the share button women could get access to licenses that they needed to then sell their products at for a higher rate, a bit more globally. Then of course that can bring back that income back. We also saw diversification. So actually there are other ways that these groups of workers can make money, so diversify what they're doing. And through that awareness and the skills and those opportunities can bring that opportunity. By getting that health and safety working on that ground level, it can obviously contribute to Agenda 2030 through the Sustainable Development Goals. And obviously it can help create that safe and healthy working environment that we've been talking about as that fundamental principle and right at work. So I'm really pleased to say actually that this has been providing the opportunity to test and develop the model that can help drive real change, bring in vulnerable groups from the precarious, dangerous, unhealthy and informal work into safer, healthier and more rewarding formalised work that will not only benefit them, but also the families, their communities, and then ultimately that economic piece I was talking about, it can ultimately also support the wider society at large and economies as well through the provision of good and decent work. And as we're talking about the Sustainable Development Goals, IOSH also back in 2023 produced a report called Delivering a Sustainable Future, where we've mapped the contribution of occupational safety and health, either direct or indirect, to those SDGs. So through good occupational health and safety management systems and practices such as risk assessment, provision of occupational health, it can contribute to the Sustainable Development Goals. Next slide, please. And this is the last slide from me, where I just wanted to talk about that transition from the informal to the formal economy. And I sort of mentioned we can see a bit of that actually. If you get on the ground, the right, safe working practices to support individuals to work, those opportunities can present itself. But the informal to the formal economy is a challenge. And again, if I go back to that Director General report that I mentioned at the start, the Director General actually says that the majority of the world's employed population, and that report talked about more than 60%, actually work in the informal economy. So when we're talking about having the right legislation, the policy and the frameworks in place, and I sort of mentioned about those vulnerable groups as well, are all of those workers covered in frameworks? Have they got employment status? Have they got the right social protections? Normally they haven't if they're in the informal economy. They're outside the bounds of the laws of the lands and the labour and the social protections. So in order to support that transition, we've obviously talked about opportunities at the ground through the IOSH projects being an example where you can support locally those different workers and in those local communities. But actually at a national level, it's important that actually what is that national profile, looking at different countries, what's the employment status, how many are in the informal economy, how many are in the formal economy, what's the data, so where are you having highest incidents happening in those different locations, what's the reporting rate like? Are people reporting different incidents? So it's important to build up that profile to see actually where are we at the moment, and then making sure that that framework is put in place. So when I talk about the framework here, it's recognising the OSH conventions that are in place through the ILO, the International Labour Organization. So we've got two fundamental OSH conventions now, 155 and 187. And actually, if we can help drive a safe and healthy work environment through having good OSH national frameworks, OSH policies, plans and programs, which can help target initiatives and work. And it can help put OSH into that political, economic and social development strategies. So for me, it is about policy cohesion of good occupational safety and health, Depending on how different countries are set up, there might be ministries of labour, ministries of health. There's also environmental action and agenda. So what we really need to start to see is that policy cohesion where we can talk about occupational safety and health across those different domains and get that right national dialogue to get OSH embedded where it's needed. So we see it as part of that solution and that direction of travel. So we also mentioned the tripartite approach to this. So it's important that governments, businesses and worker reps do come together to direct work towards decent work, having the right legislation in place. We talked about having the right laws of the land. It's important to support those through these different employment groups, having the right social protections, the training and the skill development opportunities, and basically having that system approach to promoting OSH uptake. And this comes back to the definition I mentioned earlier, that actually all actors have a role to play. So it's important, as well as having the laws of the lands, those policies, those standards in place, you still need a resourced inspectorate to make sure that there's compliance happening to those. Businesses need to be equipped with the right organisational governance arrangements, and also workers need the right access to everything that we've talked about at the start, from that fairness, equal opportunities, skills and development. So it really is driving that change, not only from that national level, but actually at that localised level. So there's a bit of top down and bottom up here. And I suppose my parting comment was going to be that actually we say that good health and safety is obviously good for business through the positive impacts that it can have. But there's also lots of research out there which talks about how good work is good for you, for us individuals. So if we can support work to be that good work, that decent work, then naturally we're supporting people to go to work, to remain in work, to be productive at work and get those benefits they can take to their local economies, their families and that wider agenda. So I will stop there and pass on to the next speaker. Thank you.
Thank you, Ruth. I think Dr. David Alku, it's over to you.
Right. Thank you, Kelly. So hello, everyone. I'm excited to be here. My name is Dr. David Alku, Vice President of IOSH. At IOSH, we are driven by conviction. And that conviction is, it doesn't matter where you were born. It doesn't matter where you live or the industry you work in. Everybody deserves to go home unharmed. Nobody should be harmed because of work, because of trying to feed their family. It's just not acceptable. But sadly, it's not the case for a lot of people, especially women in emerging economies in the informal sector. And this is why this work is so important. And this is why it has been so key that IOSH has partnered with our global partners to try and improve the lives of these women. And you will see that it is working. Next slide, please. So what you see on the slide are 4 wonderful communities. And when you're with these women, it's amazing. They wake up at the crack of dawn, work so hard for so little, and yet keep their spirits high. So we thought, how can we help them? And luckily, we got our amazing, amazing partners to come on board and help us to improve their lives. The 4 communities we identified to help, there were 2 in Ghana and 2 in Kenya. In Ghana, we had the shea butter workers and the textile workers. And in Kenya, we had the fishmonger women and the quarry scavengers. In 2023, risk assessments were carried out for these 4 groups of women. And it really highlighted that they are really, really at risk. And a lot have been injured, a lot have died. So this brought to mind that we should help them improve their health and safety. But beyond that, how can we improve their lives overall? Next slide, please. So although the long-term goal is to ensure that these women get healthier, get safer, we went beyond this. By collaborating with our partners, such as the International Labour Organization, the International Social Security Association, the Ministry of Employment and Labor Relations Ghana, the Department of Occupational Safety and Health Services of Kenya, the Commonwealth Business Women's Africa. We have come up with a way, one, to make them healthier and safer, but also to improve their lives socially. How does moving them from the informal sector to the formal sector help them? It puts them under the umbrella of the law. They now have the right to a minimum wage. They have the right to protections under the law. They have a right to be kept healthy and safe. And they've been able to register their products, for example, in the food and drugs authorities of the countries. This means that they can access better markets, both locally and internationally. What this is going to cause is that they're going to have more profit from what they're doing. More profit means more money into the community. This means that young girls can stay in school. They don't need to go out of school or leave school in order to help to feed their families. This means that these young girls going to school can then be educated. They can become health and safety professionals, lawyers, doctors, engineers, and then they can then come back to this community and improve it. What we are hoping to see when we walk into the community in 5 years is an unrecognizable community. We would be like, wow, is this the community we came to before? Because we hope to see it develop just because of these interventions. And we are already seeing it. We are seeing that these women are now being invited into conversations of the community. Before, it was just the men having the conversations, but they are being recognized as important contributors now. So the work, what we're doing is working. And we're going to show you documentaries later just to highlight what is being done. It's really, really key because we saw a lot of harm being caused to the women, both from health and safety and also socially. We saw that young girls are getting pregnant too early just because they have to. Unfortunately, they are sexually exploited in order to be able to feed themselves. With these interventions, they have enough money, and this takes them away from this. So what we are doing is we are hitting two targets. We're hitting occupational health and safety, as well as social sustainability. Next slide, please. So already we are going around to see the progress so far. We are mapping out what has been done so far. And this is important because we're going to use these communities as case studies. Case studies to show that occupational health and safety interventions don't only keep people healthy and safe, they also improve lives. ILO is already planning to roll these interventions out beyond these communities to those entire regions. Can you imagine the number of lives that are going to be changed? Can you imagine the ripple effect? It is possible that one of these women from this community one day can be president of these countries because of these interventions. All of this wouldn't be possible if not for our local IOSH members, our global partners, and everybody else who has been involved in this. So I want to take an opportunity to say a huge thank you. Thank you, thank you, thank you. This wouldn't have been possible without you. Next slide, please. So thank you all for listening to us, for being here, and we look forward to your continuing support. I'll now hand back to Kelly.
Thank you, David. As David mentioned, we're now going to showcase a short overview film of the documentaries. The first film is the Rural Africa Documentaries Overview, which depicts a snapshot of the 4 communities and the projects within the documentaries to highlight the chronic working conditions that these women faced on a daily basis and the OSH interventions that were needed to improve the working conditions and ultimately save lives. The second film focuses on the IOSH Golden Thread to showcase how making changes from a high-level policy on a global scale with the support of partners to deliver high-impact projects on the ground that truly do make a difference. If you do want to find out more about any of these documentaries and watch the full versions, which I really do highly recommend, please do visit IOSH in Action on the IOSH website. I'm going to hand over so we can watch the videos now.
We are an occupational safety and health charity, and that's our remit, to keep people safe and healthy in work.
In health and safety, we have a hierarchy of control, the highest of which is elimination. We don't want to treat the effect, we want to stop it from happening in the first place.
Bangona hizi cobwebs, hizi mingi hivi, inaweza kuwa pia source of fire.
The important first thing to do is to understand how people are working, because understanding the tasks enables you to be able to identify the hazards that they might be exposed to.
These people are working, bending down in terrible posture positions, breathing in the dust from those rocks all day, every day. On a good day, they can earn £1.20. That is less than the price of a bag of flour that would last 3 days.
Unakuja huku, unaifanya hii kazi na ni ngumu. Inakuumiza mwili. At long last unarudi nyumbani bila kitu.
When they're processing the fish and scraping off the scales and filleting them, these fish have got very sharp fins, so you can get puncture wounds in the hand. When they're frying, so they're dealing with hot oil, they often get burns and splashes.
There's a lady who was carrying her oil from the fire and she fell down with the oil. So she got burnt, her face, her body, she's still recovering.
The sad thing is that these women get injured whilst making a living and then have chronic pain and become disabled.
There is a very real human angle to this. 2 of the individuals that we interviewed for this project are now no longer with us because of the dangers that they faced on a daily basis.
As an occupational health and safety professional, I know it's possible for us to empower these women and to put controls in place to make sure that they go to work every day and go back home safe.
A risk assessment, a report, never made anybody any safer because it's a piece of paper. It can't make anybody any safer. What these reports have enabled us to do is to talk to our partners about how we might make differences locally.
For organizations such as the UN or the International Labour Organization, upon hearing about the plight of this woman, will find that that aligns with their goals and hopefully provide such funding that is needed.
I'm Vanessa Harwood-Witcher. I'm Chief Executive of IOSH, the Institution of Occupational Safety and Health.
I'm Alan Stevens, Head of Strategic Engagements at the Institution of Occupational Safety and Health.
We started to work at international level with our sort of strategic partners and identify how we can then help in country. 1 minute we will be working with people at global level, so people like the United Nations, the World Health Organization, the International Labour Organization.
All the way down through an asteroid belt of national leaders and local institutions, working down to delivering high-impact projects on the ground.
We work with other organizations who can actually channel the programs and the strategies that we develop and bring it to the shop floor. So we work with the ILO, we also work with IOSH.
Those strategic partners help us to find the right places to go and work. So when we align with their strategies, it starts to give us a really good indication of where we can have that impact. The first point of call was to work with the government, so through various ministries who have an influence on occupational safety and health.
Safety and health is one of the most important fundamental pillars for societal stability. 83% of our workers are in settings that are not really formal, and they are the most at risk.
If you are able to identify these women and group them into cooperatives, to instill into them some of the formal ways of doing things, and then through that you are able to identify them, reach out to them, and provide the services that they need.
Our philosophy, our belief is better working conditions, a happier workforce that works in a safe environment where there are not accidents, where there is no chronic disease. That workforce is much more productive. And this is why this collaboration is so critical, because it takes the ideas into something real.
We hope to be able to galvanise the capital and the investment to get those people back into proper ways of employment as fast as we can.
What can be more motivating than knowing that you have protected life, you know, you've supported those local communities? I mean, it is massively motivating.
I'd now like to hand over to Helena Abatwini, hopefully I've got that right this time, to tell us a bit around the Ghana community's stories in a bit more detail. Helena, over to you.
Good morning once again. My name is Helena Abatwini, founder of Lana Empire Africa Foundation. As we all have seen, the videos just showed where we were from the beginning before the IOSH risk assessment came into the picture. These women, my community, my mothers, they were working in harsh conditions. That's to the Shebata women and the weavers. They crack everything on the rocks. If the IOSH members that have been to the village will tell you how rocky the village is. And they do everything because they have no place for their work. They always work on the rocks under a hot, scorchy sun. And this were affecting their health and also not letting them improve economically. So IOSH came into the picture to do the risk assessment. And when they were doing the risk assessment, several risks were identified. For example, how these women not only see that what they are going through is actually affecting their health, and perhaps they've noticed it, but they have no better option. So they keep doing this work in a harsh condition without even taking safety precautions. Everything was just disorganized and just trying to survive. When IOSH came into the picture for the risk assessment, they realized that where they were working wasn't safe and the manner they were working wasn't that good. So it is actually affecting their health gradually. Some of them end up having strokes, some being hospitalized. They keep taking painkillers just to be able to sleep at night, because without them, they can't really sleep. This is where the community was, and that was really bad. And when you look into the videos that they just played, I was dancing. I wasn't dancing because their condition was okay. I was dancing because somebody has recognized something, somebody has seen something, and they are here to try and help us make it change, to try and help us improve these women's health, try and help us improve the community at large. That's why we were actually, and I was really happy dancing. So from these risk assessment, they also identified from the weavers that the paddle that they step on is actually hurting their feet and really putting them in a bad condition. Their sitting posture was that bad because the chairs wasn't higher enough or the machines wasn't higher enough for them. So IOSH, during the risk assessment, was able to identify that and they worked on it. Next slide, please. Just see. So with the Ghanaian part of the risk assessment and all that IOSH has done, people came into place. We got other people that supported us. So that was after the risk assessment. And now after the risk assessment, we did have the documentary, which we showed to people and to showcase what the community is actually going through. That was really highlighted in the community and in the documentaries as well. It was highlighted and captured perfectly well. Most people that watched these documentaries were really, some didn't even know these women were going through this when it comes to their shea butter production. People use shea butter without even knowing how it is made. They don't even know the condition these women are in. They don't even know the entire process that they go through to get this product out, especially the weavers as well. They don't know what they go through to bring these amazing fabrics. So after the documentary, and people that are fortunate to watch it are able to come to our aid. We are not there yet. We are not like fully improved and everything is okay, but we've gotten help. We've gotten help to actually put up a facility for the shea butter women. The facility has been built and we are yet to now work on machineries to equip it for them not to even work outside, but they will work in the facility for health and safety conditions. And this will also improve on their social and economical life because they are not able to scale up. Ever since I know them, they keep working and working and working, but continuously they're always at the same place. But now they are able to get a facility, and I'm sure they're gonna scale up and meet up with the international market. They've also had the certifications for their products, which means they can go for conferences, they can go to exhibitions, people will come to the facility, will come to the village to see what they're actually doing. Because in Ghana here, if you're not registered into the formal economy, people don't like patronizing you. And now they have that. They have been moved from the informal sector to the formal sector by registering the Lana Empire Africa Company Limited for them. This is their own, and this is the name they're going to use to be selling every single product they have made. They have also gotten the attention of cosmetic brand, one big cosmetic brand. He has expressed his interest into working with them. However, we are still waiting for a more clearer and contract or investment plan from them. This has helped the women a lot. If you go into the community right now, the men are beginning to think, oh, our wives, our daughters are actually doing something Because in Ghana, if you don't have something doing, especially in the northern part of Ghana where these women are located, you are not included in the society. You are discarded easily. So now that they've seen this building and it's been said this belongs to the women, and this is where they're going to be working from now henceforth, they're beginning to say, okay, wait a minute, our women are getting there. And the children are happy because a happy mother makes a happy child, because they nurture the children, they make sure the kids go to school, and without work, without safety, without economical growth, how are they going to do this? But now there is hope. That moment has arrived. And I know it's not going to take long for these women to try. And before, let me not forget something. After the risk assessment, we didn't have a place for the weavers yet. So as a result, they were still weaving under the trees as before. Then one of them, unfortunately, she was pregnant. A young weaver was bitten by a snake and she passed away, actually, sadly. But from now, we are able to get them a temporary workplace where we've moved these weavers from under the trees to that is where they're going to be, and they'll be working there till we get them a more equipped and special or nice place for them to keep working and to eliminate all these occupational hazards and the risk of them being bitten by snakes and everything. So from where we are, the improvement is there. We're seeing that we've gotten a step closer to our destination. And I know IOSH and its partners are working really hard to make sure these women don't go back to where they were a few years ago, but they'll keep improving and will be on the international market. With that, the community will improve tremendously. And they are very happy. They keep telling me they're very happy and they're grateful to IOSH for all they've done, for even stepping into the community. They know and they believe things will change for the better and keep getting better from now till we know when. Sorry. So thank you very much, everyone, and thank you, IOSH. Thank you for inviting us, and thank you for including us in this, your project. We are much grateful. Back to Karen.
Thank you very much, Helena. Over to Nanis, who's going to talk about empowering communities in Kenya.
Thank you, Carly. My name is Nanis Kanana, IOSH consultant. I'm based in Kenya, Nairobi. First, an orientation about the projects in Kenya. So Commonwealth Business Women Network Africa has been working with several communities in Kenya to empower women and also on training them on financial literacy. And specifically, I'm going to focus on the two projects. That is the fishmonger women in Kisumu and the quarry scavengers in Kajiado. And they had been working on these projects with these two communities to empower them and also improve their financial literacy. And they realized that as much as they were training them on financial literacy, there was still a gap. And that gap was the health and safety of these particular women. And I think that really highlights how much the aspect of occupational and safety and health is. And that is when they made contact with IOSH in 2023. And by November 2023, we were able to conduct the risk assessments in these two particular groups of women, that is the fishermonger women in Kisumu and the quarry scavengers in Kajiado. So, and I'm specifically going to talk just a little bit about the quarry scavengers in Kajiado, whereby these particular women were working in the quarries. They didn't have the right tools. They were exposed to a lot of hazards, quarry dust, no PPEs, a sector that is not regulated at all. And really, as much as the discussion has been there about OSH as a fundamental human right, it was not a reality for this particular group of women. And after conducting the risk assessment, for sure, the solution was not to mitigate the risk. The solution was to remove the women from the quarries. And that is when we started discussions on really how we can make the work they were doing safer. And specifically in terms of what other, now that the decision had been made that the best thing was to remove these women from the quarries. So what other skills could we really introduce them to? And we identified two main skills that we could introduce these women to. And one of them was introducing them to sewing. And the second one was introducing them to production of fish flies, which the women have picked up very fast on, and they're able to make more. But apart from that, from an occupational health and safety perspective of it, is that these women, their health has improved because then they are working in a less, the risk profile of the new work streams is minimal. And if you visit this community today, the smiles in these, the faces of these women can tell of the hope that they really have. And I would say that working with these particular two communities has also opened us to really understanding that the challenges faced in the informal sector, for example, now in this particular community, requires a very collaborative approach and really working with different stakeholders, which we've been trying to do. From a policy perspective, we have been collaborating with Doshi's Kenya just to really make sure we drive the discussion on what is really required. And apart from that, it has helped them really even increase their income. And specifically, for example, when they were working in the quarries, they were earning 20 shillings in a day. That is way lower than $1 in a day, which is really not sustainable, or was not sustainable for them because then they can't afford things like PPEs for the work, medical insurance. For example, in Kenya, the basic is that at least every Kenyan should have access to the national medical insurance, and which what we are calling SHIF at the moment in Kenya. And this was not really some of the really services they could access. But currently, the women making fish flies are able to make at least 40 shillings for one fish fly, and they make several of them in a day. So it's been able to improve not only earnings, but it is also translated to really them being able to access the medical, being able to take the children to school. We have now the women who are really experiencing severe health effects of the quarry dust. Their health has improved. We have been able to absorb some of them now into these new work streams. And it tells a story really of how much occupational safety and health is, even in the informal sector. And specifically for these particular women, initially the discussion was just empowerment and financial literacy, but after the risk assessments and identifying really the impact and what we could do and running these interventions, introducing the new skill sets, addressing the issues of occupational health and safety, then we've been able to see the larger impact it has on really safer skills, a safer and sustainable livelihood, and the impact it has in the community. So specifically, the greatest achievements for this particular project has been with the engagement of the stakeholders, who we've very much grateful to. Of course, IOSH has done a very big aspect of it. IOSH has also helped us really reach out to more stakeholders. Definitely, DOSH's Kenya have been very supportive with the discussions about policy and aspects like that. We've also received a lot of support from the community, the residents community, where these projects are going on. And because of that support now, we've really be able to see this transformative change in this particular project. So we need, my observation from this particular project is that we also need to scale this particular project so that we able to really absorb more women in these communities into these new safer skills, and really maximize the impact of the good work we've done together with IOSH and the rest of our partners here in Kenya. Thank you, Kylie.
Thank you, Nanis. I'd now like to introduce Dr. Musa I will get it right, Nyandusi, to talk about the importance of OSH collaborations. Thank you.
Thank you, Kelly. I think the name might be easier to pronounce if you put a hyphen between the A and the N. It might be easier. So, good morning, colleagues, and good afternoon to those of us in the hot Nairobi. It gives me a lot of pleasure to attend this webinar, where we discuss the importance of OSH collaborations in the light of social justice. My name is Dr. Musa Nyandusi. I'm a medical specialist. I serve in the Ministry of Labor and Social Protection in Kenya, in the Directorate of Occupational Safety and Health Services. I serve as secretary. And our role is to ensure the safety and health of all workplaces. And we also charge the responsibility to administer work injury benefits for those workers who unfortunately get injured or they die in the course of their work. As a brief background of our country and our country situation, Kenya is not so different from other African countries in the way labor is organized. We have the presence of 83% of our workers in Kenya being in the informal sector. Only about between 15 and 18% of our workforce is actually in the formal sector. In terms of absolute numbers, this means we have over 15.5 million workers working in the informal sector, as opposed to about 3.2, 3.3 million workers who are working in the formal sector. We have strong legislations in Kenya that administer occupational safety and health, and strong policies in Kenya that administer occupational safety and health. We do have the Occupational Safety and Health Act and the Occupational Safety and Health Policy at Work, which administer occupational safety and health. Most of these policies will be more appropriately administered in the formal sector. And in the informal sector, you have the usual challenges of, number one, informality. Number two, the issue of unstable incomes. Number three, the issues of lack of protection and obvious vulnerability. These workers do not have the access to social protection mechanisms, such as in OSH. Neither do they have it in healthcare, neither do they have it in social security. And to a large extent, the government, being a proud member of the and good standing of the International Labour Organization, was part of the conversation in 2022 when ILO adopted OSH as a fundamental right and principle at work. And the informal sector is one of the most glaring challenges in the Kenyan economy in terms of inclusion in the protection of the workers who are working in the informal sector. The recognition that the government alone may not be able to solve the informality of work overnight echoes the importance of creating partnerships with other players in creating the necessary framework for the inclusion of OSH in the informal sector. So Kenya remains a proud partner of the Global Coalition, and indeed we were there at the launch of the Global Coalition at the ILO that promotes equality, fairness, and human dignity. And this collaboration reinforces our commitment to addressing both the economic and social dimensions of justice. And the integration of the OSH initiatives in our social justice framework ensures that safe work and a safe work environment remain a fundamental right to every worker. Next slide. So the two highlighted projects that were conducted in collaboration with IOSH represent the general thinking in government in the opportunity not only to promote safe and healthy work, but also gives the opportunity for us to begin having the conversation of formalizing the informal sector and create workplaces that are safe, that number one, identify the workers who are in unsafe, informal and unsafe work environments, create interventions that are impactful, and create optional interventions in settings where the workers may require to be conducted the same. So in this project, the objective was to equip the fishmongers with safe work and transition them from the informal to the formal economy. And the key areas were the collection points, where safe handling and storage was discussed. Transportation, you have the issue of the transportation of the products, the proper lifting and vehicle safety, the processing and selling. There you have a lot of ergonomic issues as well as hygiene issues. And the initiatives included the issue of the supply. In this project, the fishmongers were supplied with safety equipment. There was risk assessment that was done, and of course the training on the hazard identification and hazard management. There was also a component of financial sustainability, in the sense of these women were empowered towards the financial handling of the monies they have sustainably, and of course the opportunity for the diversification of the incomes they have. And the impact of this project, there is an enhanced safety and health and income stability in this cohort. And this is one of the projects which we hope can be scalable. What in government we call the blue economy represents a huge opportunity for job employment and for the resolution of the unemployment challenge in Kenya. And creating these job opportunities in tandem with ensuring that they are safe and healthy give us a win-win situation, in the sense that the persons getting into the workplace are going to be safe, they are going to be healthy, they are going to be covered in social security, they're going to be covered in healthcare, and in the long run, we actually create more stable economy and more progressive economies. The next slide, please. We did have the other project on the quarry workers in the county of Kajiado. The Kajiado County is a county that's about 85 about 100 kilometers, about 60 miles from Nairobi. And out there, you do have quarries, you have multiple quarries. Most of these quarries are very informal quarries. And where the extraction of the quarries are done, majority of women would get into these quarries as scavengers. Scavenger quarries, where they get the proceeds from the quarry for informal sales. So obviously, one, these women do not have any form of protection. These women primarily work for themselves. They do not have any training in the work they do. The ergonomics are absolutely wrong. The exposure to silica dust is there's a, due to the lack of personal protective equipment, the silica exposure is immense, with the possibility of development of silicosis. And the income that was accruing from this difficult work was slightly less than $1 in an entire day. So it was not impactful in terms of their sustainability. So the strategies that were adopted included the strategies of comprehensive hazard assessment, as well as the issues of the hazard assessment and risk assessments, and collaboratively implemented a robust safety protocols and provided targeted OSH training. I am aware, may not be on this slide, that there were also identified optional income revenue, income lines and work that is safer for the women, that was probably more appropriate for them than the work that they were doing in the quarries. In this project, getting to uphold the workers' right and dignity was a key focus. A key focus on boosting productivity and the reduction of injuries, as well as the conversion from informal to formal employment, and get them into the protection of the social welfare that I had mentioned before. The impact is that these quarry projects hopefully are safer following the interventions. The productivities have been improved, and there is a sense of sustained growth, sustainable growth. Over and above that, the introduction of optional income streams through the weaving and the fishnet formation in this project have been a big winner, in the sense of creating a sense of formality and moving especially the women to occupations that are more appropriately suited for their biologic makeup. Next slide. So I would wish to thank you. The take home from ourselves is that these two projects are a manifestation of what collaboration can achieve in getting occupational safety and health to be practiced as a fundamental principle and right as enshrined in the International Labour Organization, and also gives us opportunity to bring alive the incorporation of this, including in the informal sector. Government remains committed, but obviously we will need to get partnerships that begin to resolve this issue of informality and create more sustainable jobs. I would like to thank you and hand this meeting back to Kevin. Thank you very much.
Thank you. So we don't have any questions in the question and answer section. I'm going to leave it for a couple of minutes, just a minute or so, to see whether anybody does have a burning question. Okay, so I want to thank everybody for attending the Empowering Women in Rural Africa. Oh, sorry, apologies. Do we have any closing comments from any of the panel? Is there anything additional that anybody would like to say?
Maybe maybe just a recognition of the enormous task, especially in the setting of economies such as Africa, in formalizing the informal sector. It's an enormous task which we must be alive to. Majority of our legislations are aligned to the formal work environment. We are currently reviewing the Occupational Safety and Health Act and the Occupational Safety and Health Policy nationally to recognize the fact that the informal sector plays a much more important role in the economy than the formal sector, and the need for us to proactively include it in the discussions of safety and health. We are working with the Ministry of Micro and Small Enterprises, which was created, in entrenching OSH in most of their activities. They have a lot of social inclusion activities where they recruit members into social security, into the health, into health insurance, and we would like the conversation on OSH to be alive. We really need everybody on board, because a healthier worker in a safe work environment means more sustainable societies in the long run and impactful, sustainable, inclusive development. And this way, we shall, in a small way, be able to not leave others behind. Thank you.
I think that's a very good point. I often talk about health and safety as a team sport, and we definitely can't do it on our own. Ruth, your final thoughts, please.
Yeah, I mean, what a great session this has been. I was just reflecting on what I said at the start, Kelly, and all the speakers have just added different flavour and colour to it. So thinking of yourself, Kelly, and me was talking about actually safety and health should be mobilised as that agent of change to protect workers and how it links in. I think what this has illustrated that actually it is driving that change for these particular pilot projects that were undertaken in Ghana and Kenya. So for me, and I think Dr. Nandusi just explained it really perfectly there, that collaborative effort and that work that actually we do need. This is about that long-term commitment, that long-term value. And so we need to be committing into this collaboratively through all of different actors' effort together. And I really liked the final slides that Dr. Nandusi mentioned there, which actually showed how we can help support that transition into that formalised economy. So this will be a key focus of work for IOSH going on from these projects. We'll start to talk more about actually how can we support that transition through that decent work agenda and through the contribution of good occupational safety and health. So and the work that we'll do, obviously we'll need to tackle all those different elements from that national level, but also at that local level. So yeah, let's drive that change. Let's focus on that decent work, but we need to do it together. So probably that call, and I really like the call for if anybody can help and can support and continue with these projects, then please do get in touch as well. So thank you, Kelly.
Absolutely. I mean, Ruth, we've had a question come in, which is actually a question that I think Alan and I have talked at length about, and I've certainly spoken to you about, is there are very similar situations exist in lots of other countries across the world. Asia, like Indonesia, Philippines, Samoa, where I was last year. Does IOSH have a plan to identify and implement any kind of similar projects in other communities across the world?
Yeah, I mean that is a good question, and obviously in my role from the policy and that public affairs agenda, my team, we do engage with the governments, the policymakers, the standard setters. So it is about driving that long term change. So although I can't sort of commit where IOSH will potentially go next, all I can say is that we have done work in other countries and we will continue to do so. From Malaysia, we've put recommendations across into the Sierra Leone. We've obviously been supporting through the projects that have just been mentioned here. So we will continue to do that. What we want to do through our current strategy, Activate 2028, is drive that change across all individuals who can. So this is illustrative of this example, but we also want to influence and have impact. So although I can't name countries or what that will look like, I do want to give some assurance that IOSH is looking at where we can have that influence and where we can have that impact. And please, and we'll start to talk a little bit more about some of these projects that we have been doing over a number of years. And I suppose look at the IOSH in action page, which will talk about this particular project. But over coming months, we'll start to add to that and go, actually, we've done all this over a number of years, but what's that? But you can't always see the value creation for a number of years after. So we'll start to pull some of those cases forward. And then hopefully, for me, it's about that scalability and how we can hopefully then demonstrate or illustrate where this is working really well and how can we then promote that in other areas to say, look, let's have a go and let's try and reflect this elsewhere. So it's on the agenda, Kelly, and thanks to whoever put that question in.
And I would push back to our audience and say, if you have any ideas or any opportunities where you think IOSH can get involved and make an impact in the similar way we've done in Ghana and Kenya, please contact us. There's an email address which is international@iosh.com, and I'm sure the teams within IOSH will pick those up. Helena, I saw you had your hand up before. Did you want to add anything just before I close the session? Nanis, go for it.
Thank you, Kelly. I think this has really been the 4 projects, the 4 communities. This has really been an opportunity even to better understand the challenges that are there in the informal sector. And I think it's also an opportunity to scale these learnings, not just to the 4 projects, but also now to a scale of industry specific. For example, in the construction sector, in the agricultural sector, in the transport sector, whereby we have these kind of setups of informal workplaces. How can we scale this? How can we support? Then lastly is to really thank everyone again. Everyone who has been involved in the project, especially in Kenya, all the stakeholders and all the volunteers. Thank you.
Thank you. David, very quickly, because we're quickly running out of time now.
So very quickly, this is a call out to the OSH professionals all over the world. Look around you, your communities. A lot of people are suffering. With very low cost interventions, you can greatly improve your lives. So right in the corner wherever you are. Thank you.
Thank you, David. And I think that's a really great way of kind of summarizing. There are so many low cost, high impact differences that we can make and can really genuinely save lives and improve lives and communities. So I want to thank everybody for attending this Empowering Women in Rural Africa, Tackling Occupational Safety and Health Risks for Social Justice webinar today. I want to thank our speakers. It has been so enlightening to hear your different perspectives and motivation, and it's motivating to know that we all share the same view, that everyone deserves equal economic, political and civic rights and opportunities for social justice. We know that keeping people safe and well at work promotes healthy lives, communities and societies. It's sustainable business practices, productivity and performance is improved, and this gives us all hope for the world. Our projects in Ghana and Kenya are ongoing. We are aware that this is only the start, and we continue to work with our partners to support these communities and improve their working conditions to improve and save lives, showing how together we can make a difference. IOSH will continue to assure the safety, health and well-being of all workers, wherever they are in the world, whether in the formal or informal economy, and we champion a safe and healthy environment as a fundamental principle and right at work alongside our partners in the Global Coalition. If you haven't seen the documentaries yet, where have you been? What have you been doing? Please go and watch them. The QR code is very conveniently placed on the final slide to go and visit the page. Honestly, they are absolutely and utterly brilliant. We obviously heard from Ruth today explaining how OSH can help achieve social justice. There are millions of people worldwide who work in unsafe, unhealthy conditions every day. Harms arising from this are entirely preventable if we share and implement good OSH practices, we raise awareness, develop skills, and we engage in social dialogue and help transition workers from exploitative informal economy work to better regulated formal economies. Tomorrow is the 20th of February. It's the World Day of Social Justice. So please keep an eye from our partners, the ILO and Global Coalition for Social Justice, who will be raising awareness on platforms like LinkedIn. And please be sure to get involved in their posts and other activities. As I said, when Ruth and I were talking, if you have any further questions, ideas, or opportunities for us to be able to collaborate, or you'd just like to discuss any of the topics that we've raised here today, please contact us at international@iosh.com. Thank you so much for all of your time. I'm really energized. I want to go and look in my local community now and figure out what I can do to make the world safer and healthier directly where I live. So take care, everybody. Look after yourselves and each other. And thank you very much for your time.
Thank you. Thank you. Have a great day.